How's it going, guys? Past level question, MSK anatomy, neuro, steps 1 and 2. 34-year-old man, 1 week history, difficulty with his right hand movement. Physical exam shows his hand, B, in contrast to a normal, healthy subject, A. He works in construction and frequently runs, swims, bikes for triathlon events. What's most likely explanation for the findings? Choice A, diminution, median nerve function at the elbow. Wrong fucking answer. This could be supracondylar fracture of the humerus or distal shaft fracture. I've seen both in MSK exams. You're going to lose most function of the forearm, obviously most of the lateral muscles. You're going to lose the first 3.5 digits, the hand. You're going to lose thumb opposition. Okay, so contacting the thumb to the pinky is high yield. Wrong fucking answer. Choice B, diminution, median nerve function at the wrist, carpal tunnel syndrome. Wrong fucking answer. So you're going to lose just the hand findings, the first 3.5 digits, the thenar eminence. So for USMLE, it's all about the diagnosis and management of carpal tunnel. You got to know it can be idiopathic, of course, associated with computer use, but they like bilateral carpal tunnel syndrome in construction workers. That shows up on an MSK exam. And then just uni or bilateral, you can see it in pregnancy from edema, acromegaly, abnormal growth of the tendons. You can see it in hypothyroidism, mix of edema, and also GAG, glycosaminoglycan deposition. And then obviously the Tinel and Phelan tests to diagnose, but I've seen MSK questions on 2CK where they don't even list those as diagnostic steps. They'll just go straight to electrophysiologic testing. And you're like, what the fuck is that? It just means electromyography and nerve conduction studies. So you need to know that can be done for carpal tunnel syndrome. And then next best step of management is going to be either use of a wrist pad with a computer or a wrist splint. They're not going to list both at the same time, but I've seen them for different questions. After that, NSAIDs are wrong. They want triamcinolone injection into the carpal tunnel. That's corticosteroid injection. Not the same thing as IV steroids. Got to be careful. Surgery is always wrong for carpal tunnel. Causes the $1 million lawsuit where if you fuck up the surgery, the patient loses function of their thumb. Choice B, wrong fucking answer. Choice C, musculocutaneous nerve dysfunction. Wrong fucking answer. All you need to know for USMLE is that this has 2 roles. Number 1, it plays a significant role in biceps function. Number 2, sensation of lateral forearm. That's it. Wrong fucking answer. Choice D, loss of radial nerve at the forearm. Wrong fucking answer. Okay, so classically the injury they want you to know for radial nerve is of the humerus. Mid-shaft fracture, the humerus, really high yield. Okay, and you can lose extension of the elbow. If it occurred in the forearm, you theoretically just have a wrist drop and you lose extension ability of the fingers. That's all radial nerve. So Saturday night palsy, dude falls asleep drunk on the back of a chair, his arms over it, and he can lose radial nerve that way. Wrong fucking answer. Choice C, loss of ulnar function at the wrist. Correct answer. You gotta know, extremely past level. This is positive Froment sign, F-R-O-M-E-N-T. Now, thumb adduction, holy shit, even though it's the lateral aspect of the hand, you're like, shouldn't that be median nerve? It's not. Thumb adduction, where you're contacting the thumb to the index finger, that's ulnar nerve, weirdly. Okay, we said that thumb opposition, thumb to pinky is median nerve, but thumb adduction is ulnar nerve. And positive Froment sign is where the patient cannot hold a piece of paper between the thumb and the index finger without bending one of the fingers. Okay, classically the thumb. And they want you to know that hook of hamate fracture can cause this. In addition, you can have Guyon canal syndrome either due to hook of hamate fracture or just idiopathic compression, handlebar compression, let's say in bikers, avid cyclists. Okay, so very, very bread and butter pass level for MSK anatomy, for USMLE, that you know that this hand sign, this Froment sign, is ulnar nerve. Choice C, correct answer. You know the deal. Want to see more content like my subscribe channel. Appreciate your time. That's it.